the nitty-gritty. So I'll talk to you a little bit about the aim and the structure of our Design for Care project. And then you will hear from Ms. Rashi Kumar from iCare, who will talk to you a little bit about why iCare has funded this project. And then and then after that, we will welcome our keynote speaker for today, ARC Laureate Fellow, Professor Sharon Parker, who is the Director for the Center for Transformative Work Design here at Curtin University, and also our lead researcher on the Design for Care project. I will then welcome very warmly our guest speakers, Khan Nelson and Jackie Hopwood from Witten, and our guest speaker, Paula Holden from Key Assets. And Witten and Key Assets are both two organizations who have joined us in this Design for Care initiative as participants. And finally, we will talk to you a little bit about the research process and a community of practice to show you how you can get involved in our research. And this will be led by Professors Anya Johnson and Helena Nguyen, our collaborators at the University of Sydney. So I'd just like to start with giving you a bit of the broad aim of our project, and we have a very practical research question. As you will learn, so our question is, how can we leverage work design as an intervention to reduce or prevent psychological injury in the New South Wales healthcare and social assistance industry? You will learn all about work design from Professor Sharon Parker, and also a little bit about how psychological mental health compensation claims have risen so much in the past few years, which kind of speaks to why we want to understand how the core work experiences of employees could be perhaps made better to address mental health issues. To answer this question, though, we are a very large team. So the Design for Care research project is funded by iCare New South Wales and is a consortium or partnership, if you will, of 3 universities. The leading partner is the Center for Transformative Work Design at Curtin University. We are working very closely, however, with our partners at the University of Sydney to carry out our intervention research. And this is led by Professors Anya Johnson and Helena Nguyen. And I'm sorry, the part of the Center for Transformative Work Design is led by Professor Sharon Parker. And together, we are delivering what we call the Path to Smart Work Design. PATH is the research process, which Anya and Helena will take you through shortly, that we use to study work design through the SMART model, which is also something that Professor Sharon Parker will take you through very shortly. Our work, however, is also complemented greatly by researchers at Monash University, which is led by Professor Alex Colley. His team is conducting an industry analysis to understand which segments in the healthcare and social assistance industry are particularly vulnerable to mental health claims and psychological injury. His team is also giving us some deeper insights on the risk factors for psychological injury in the health and social assistance industry, so that University of Sydney and Curtin can look at these factors when we work with organizations. On the slide here, you can see our very large project team, and on the top row, you can see our lead professors, all of whom are experts in the field of work and mental health. And now it is, and they are supported by all of us on the slide here and more. And now, without further ado, it is my absolute pleasure to introduce our first speaker, Ms. Rashi Kumar from iCare. Rashi leads the Strategic Investments and Innovation Team, formerly known as the iCare Foundation. And in this role, she is responsible for working with iCare stakeholders to find innovative approaches to address psychosocial risks and deteriorating health and social outcomes in New South Wales workplaces. Over to you, Rashi, and I will mute myself.
Thanks so much, Anu, and hi everyone, really happy to be here today. And thank you to Curtin for inviting iCare to join the conversation and share a little bit about some of the drivers that led to setting up this initiative and why it's so important to iCare. So from an iCare perspective, we commenced work on this initiative just over a year ago. From our claims data, we could see that the healthcare and social assistance sector were overrepresented when it came to psychological injury claims at about 3 times higher than other industries and growing quite consistently, which is of concern. And from that, we could see that mental health outcomes were deteriorating for workers, and we were hearing from employers that this was of obvious concern, but there was limited capacity to address the challenge because resources are either fully or overutilised already towards service delivery. So one thing that we couldn't reliably see from the data is what is actually driving the deterioration of health outcomes and who exactly is most impacted or vulnerable, which is critical so that we could understand how we might be better able to support the industry. So we had a number of conversations with employers, workers, and mental health experts, and we knew that we wanted to invest in and fund a primary prevention approach that could be scalable at an industry level, which is why we were so excited to connect with the Curtin University team and learn more about how they were working with organisations and industry to look at work design and how work could be designed better to ultimately give people a sense of more ownership and control in their jobs and ultimately improve mental health outcomes, creativity and participation for workers. And I know that Sharon's going to talk more about that soon. So from an iCare perspective, we really view this as a long-term initiative of which the work that the Curtin Consortia are driving is a critical part. And with that, we're hoping to see a stronger understanding of and evidence base around what really works for workers and organisations in this industry, resources and interventions that will be piloted and tested properly to ensure that we learn what works without overburdening organisations and workers. And ultimately, in the long run, we would seek to work with employers and industry to adopt the interventions that have been proven to work for workers and organisations alike. So I think that's all from me, really. Needless to say, we're really excited to be launching the Design for Care initiative, or to be attending the launch. It's a really exciting milestone for us, and we're looking forward to seeing the outcomes and the work that Curtin will be leading and seeing the industry engagement that comes with it. So with that, I will hand back over to you, Anu.
Thank you so much, Rashi, and we are just as equally excited to be working on this project as we are very passionate about this field. So without further ado, I would like to introduce to you today our keynote speaker, Professor Sharon Parker. Sharon is an ARC Laureate Fellow and also a John Curtin Distinguished Professor and the Director for the Center for Transformative Work Design at Curtin University. Sharon has conducted research on the mental health in the workplace for over 30 years and contributed to UK, US, and Australian policy on the topic. She was the lead consultant on the Safe Work Comcare Good Work Design initiative and was the lead researcher on the WA Mental Health Commission funded research in 2018 on FIFO work. She is a member of the National Mental Health Commission's National Workplace Initiative Frameworks Working Group, and she was also invited to the Attorney General's office to provide evidence on mental health to the Industrial Relations Reform Working Groups. And she has given over 20 keynote talks on the topic to industry, government, and academics. Professor Parker has attracted competitive research funding worth over $40 million, and in 2019, she was named among the world's most influential social scientists in the Web of Science 2019 Highly Cited Researchers Index. She was ranked as in the top 1% of researchers in the world. She's been cited more than 30,000 times and has published more than 150 internationally refereed articles. And today she will be talking to us about a work design approach to improving staff mental health and well-being. So without further ado, I welcome Sharon to speak to us today, and I will be sharing my screen.
Thank you so much, Anu. I think that I have shared my screen, so if you can just confirm.
Yes, I can see you.
All good? Excellent. Well, thanks, Anu, and welcome, everybody. It was absolutely terrific to see so much interest in our session today. So we really hope that you enjoy and are keen to get involved with our work. What you can see in front of you is some statistics around the levels of mental ill health. And this is using a particular measure. It's a measure called the K5, or sometimes the K10, that measures psychological distress. And this shows the percentage of people experiencing high or very high psychological distress. And it's a useful measure because it's been linked to clinical work, and people with these levels of psychological distress are people that benefit from clinical intervention. What you can see there is that the sort of population statistics for general Australians pre-COVID were around about 12, 13, 14% of Australians experiencing high or very high distress. And of course, that's too many. That's a large number. What you can see with the third column there is we did some research during COVID. Those levels of distress actually increased, particularly in the early days of COVID. But what you can see in that next column is this is some data that we have on aged carers. It's not necessarily representative, it's just a sample of more than 500 that we have from some of our own research. And you can see there that amongst that sample of carers, 27.5% had high or very high distress. And I think we would all agree that is a large number. I've put that actually next to the data for our fly-in, fly-out workers, who are actually considered a very at-risk population. They have even higher levels of 33%. So I think this sort of links back to Rashi's earlier comment that in the sector that we're focusing on here, there are more claims than in other sectors, and it sort of relates to this data here. I mean, just more generally in Australia, there's a huge cost of mental health. More than 10.9 billion estimated per annum of the costs of absenteeism, so, you know, not coming to work because of stress, etc. Presenteeism, which is when you turn up to work but you're not really well and you're not being very productive, and also the cost of compensation claims. So pretty huge cost there. Now, what about the sector we're focusing on? It's pretty clear from the data that we just talked about, there's a real need to think about how to prevent this psychological harm and improve employee mental health. And now we know from the Royal Commission, also other inquiries and many other sources, that there are some big scale changes needed in this industry around funding, also, you know, just all sorts of other factors that have been identified. So we know that, and some of those changes are coming, but some still probably need to come. Our question is really, what can we do in the meantime? Because it's going to take quite some time for those changes to roll out. And actually people are saying there might not be enough anyway. So our question is really, can we do anything about mental health by changing the work design in the meantime? I just want to first of all remind all of you, I'm sure you know it from your own lives, that when we talk about mental health, we don't just mean ill health. So just as in the same way as if we talk about physical health, we don't just mean, you know, not being sick. We also mean things like being fit and having good cardiovascular functioning. The same is true for mental health. In fact, the World Health Organization defines good mental health as a state of well-being in which each individual realizes his or her own potential, can cope with the normal stresses of life, can work productively and fruitfully, and is able to make a contribution to his or her community. So that's a really lovely and helpful definition. And one of the things it says is, you know, we expect there to be normal stresses, and that's true in work. There will always be some normal stresses, but what we want is for people to be able to cope with those stresses and to be able to make the contribution that they can make. So this is a sort of spectrum, you know, that some people have developed that recognises that right down there in the red on the left, we can think about mental ill health. And so this is things like being anxious or depressed or not being able to sleep or being exhausted, all those sorts of symptoms. And then we can go right up to the other end. You can see the full spectrum there to talk about people who are thriving, you know, who are not just, again, not being unwell, but people who are actually engaged and resilient and learning and growing and contributing. And so when we talk about mental health and well-being, we are talking about this whole spectrum. So moving from ill health right up to optimal health. What I'd like to do fairly briefly is just introduce the Thrive at Work framework that we have introduced here and developed here at Curtin University, that's been taken up by many organisations across Australia. We actually developed this framework for a particular purpose. And the purpose was that, and this is the 3 pillars of the framework: mitigate illness, prevent harm, and promote thriving. So you can see it sort of maps onto that spectrum that I've just shared. What we were finding was that most organisations were focusing on mitigate illness. And what that means is, you know, recognising that there are, you know, 15 to 20% of people that are experiencing unwellness at work or mental ill health. And it's really important with those people that we know. So we need to monitor, we need to know, and we also need to be able to accommodate that illness and treat and support people who are struggling in their work. So a classic example of how we do that is we provide access to EAPs or counselling. Another classic example would be we train managers in how to identify if someone is suffering from mental ill health. That's the mitigate illness spectrum, and what we observed was that most organisations are focused on that aspect. And that makes sense, right? Because people are suffering and they want to support those people. But it's also important to recognise that work itself can cause risk. And that's the concept of psychosocial risk. So we introduced this framework to try to get people to focus more on how can we not just deal with people who are struggling already, but how can we prevent harm from occurring in the workplace? And then, of course, how can we even go further and not just prevent harm, prevent illness, but also promote that thriving, which is particularly important into the future. So what we're trying to do is shift the conversation from a focus entirely on ill health and injury to also this broader sense of mental health and well-being, to focus on the 20% unwell, but go beyond to focus on the 100% of people and make sure that those other 100% do not end up in the unwell category. How can we go beyond compliance, which of course is important, but actually if we can think about mental health in a broader way, we can actually generate value for the organisation and help from a more strategic perspective. How can we move away from a notion that if someone is struggling at work, that it's a problem with that person and we need to fix them, to recognising that it might be about the system and the work design, and I'll unpack that a little bit more. And how do we go from reducing costs to high performance? Now, I won't go, this is the full model, the full Thrive at Work framework. I'm not going to go into that now. All I want to signal is that, as I mentioned, what we've learned is that organisations are particularly struggling in this prevent harm. How do we do this? How do we deal with the psychosocial risks, such as high workload or lack of control or whatever? And that is where our smart work design model comes in, which I would like to share with you next. So the smart work design model comes out of the fact that actually we've been doing research on this topic for more than 100 years. What we know from this 100 years of research is that all those things you can see at the top there, job complexity, job feedback, support, workload, pressure, work hours, all of these things influence people's mental health in the workplace. But how do we make sense of that? There's more than 30 aspects of work that have been identified that can cause risk to people. And this is where the smart work design model comes in. So basically, through some fancy statistics, we identified that there's 5 sort of big factors. The first one is stimulating. So what research shows is that if people have work that is stimulating, their mental health will be better. So that means having variety in work, using your skills, feeling that you're doing something significant and meaningful, having a bit of challenge in your work. The next one is mastery. Mastery is about this concept that most people, when they go to work, they actually want to do a good job. You know, 99% of people want to go to work and do a good job, but sometimes they don't know what they should be doing, so they don't have role clarity, and sometimes they don't get feedback on how they're going, and sometimes they don't understand how does their work fit into the bigger picture. So mastery is all about giving people that clarity and feedback. A is a big one. A is about agency and the importance of autonomy and control and influence. A lot of research shows that the fastest way to cause someone stress actually is to take away control, and especially to add in demands. So agency is all about trying to give people as much control as possible. And I mean, interestingly, we've seen that through COVID because to some extent, people have been able to work at home, not everybody, but some people, and that has increased control for some people. R is another big one, and this is about the relational aspects of work. And this really speaks to the fact that all human beings, every one of us, even the introverts, has a need to connect with other people. It's a fundamental human need. So in the workplace, we need to try to create opportunities for people to connect with other people, to connect with who benefits from the work, to get support from their supervisor and peers, and be part of a team and feel part of a bigger entity. And then finally, T, actually, I have to say, in this sector is probably the biggest one. And this is about work that is tolerable. And this is really recognising that every work has demands. So we all have a certain amount of workload that has to be done. We all have a certain amount of pressure or whatever. There's all sorts of different demands depending on the work. But those demands need to be experienced as tolerable. And that means, sometimes that means actually increasing those other aspects, the SMAR, in order to make those demands feel more tolerable. So just as an example, one of the things we did here in our work was to sketch people in various workplaces, and we did this to try to convey what work design is. And you can see here an aged care assistant, you know, actually talking about some aspects of mastery. You know, regular appraisals help you to improve or give you feedback if you did well. And sometimes when you feel tired, you get emails or stars to tell you thanks and you feel appreciated. So just a little example there. For those of you who are used to thinking about psychosocial risks, and that's the language that you're more comfortable with, all of those aspects of SMART map onto the key psychosocial risks that we know. I'm not going to go into any more detail there, but for those of you who are used to thinking in that language, just be assured that by focusing on SMART, we are addressing the psychosocial risks. We are just framing it in a different way. So instead of saying we're removing risks, we're saying we are promoting good work. So, but same thing, really. Lots and lots of evidence on the importance of these aspects of work, not actually just for mental health, but actually also for motivation and performance, and also for learning and growth. Again, I won't go into detail there, but more than happy to share with you that evidence if you're interested. And I want to just acknowledge that also this model, the SMART model, is being used now fairly extensively in many different workplaces across Australia. I want to share with you, I mentioned earlier a little bit of data that we have, just 500 people of aged carers. And what I've just mapped here is the elements of SMART that we measured in that particular survey. And we also measured whether people are feeling burnt out, whether they are thinking of leaving, so that's the turnover, and how satisfied they are in their work. And what you can see here are correlations which sort of give a strength of the relationship between these SMART aspects of work and whether they relate to burnout, turnover and job satisfaction. And we won't go through all these numbers here, so don't worry, but I just want to show that if we want to understand burnout in this sector of aged carers, you can see that just about every single one of those SMART dimensions has some sort of relationship with burnout. So we can see the same with turnover. And this again speaks to my point that smart work design isn't just about mental health. It's also about other outcomes like motivation and intention to stay in the organisation. And ditto job satisfaction. We can see that these aspects are also important for job satisfaction. And I'm just going to pick out a few here to unpack them. So what you can see there, that first one, what that shows is that skill variety. So people believing that they're using a variety of their skills. If people have got skill variety in their work, they are less likely to want to leave and they're more satisfied in their work. Just to pick out another one, I'm just picking out some of them here just to give you a little bit of a flavour. People who've got mastery in the sense of they've got the information that they need and the equipment to do their job. If they've got that, they're much less likely to experience burnout. They're much less likely to leave the organisation and they're more likely to be satisfied with their work. Consultation about change, same thing, really important for people in this sector. When change is happening, they like to be consulted. You can see managerial support. If people feel supported by their managers, they're less likely to have burnout and so on. And then last one, this is actually one of the biggest ones, so I did want to highlight it. If people feel a sense of injustice, so they feel that things are not done fairly and they're not treated fairly, then you can see, again, quite big numbers there, which means that it's quite a strong driver. That's just a little taste. Every aged care or health sector organisation we work in, these numbers look a little bit different. But that's really just to show you that these aspects of SMART really do have some importance in this sector. I'm just going to pause here and I'm going to give you a minute to go over to the Slido poll. And I have to say, when I'm like, oh, I don't want to do Slido, that looks hard. Literally all you do is you type in slido.com and then you type in the hashtag SD4C. And the question will be there on the screen and you literally just type in your response. So it's actually unbelievably easy. So pop over to Slido and just you've got a sense now of what we mean by work design. What do you see as the most critical work design issue for carers, employees in your organisation? Is it skill variety? Is it workload? What is it? Love to hear your responses. And a bit later, Anu is going to share with you what your collective response is to that. So just going to leave that on the screen for one more second. I just have one more slide, two more slides actually. So I will move on to that one. I do just want to say, and we can take questions on this if it's interesting to you. One of the things that's important with high demands is sometimes looking at the other aspects of the model, the SMAR. In other words, these aspects of work design should be looked at in a sort of holistic way, because actually if you've got high demands, it's even more important than ever to have stimulating work, clarity, autonomy and support and so on. And my very last slide, I just want to show there have been some intervention studies that are published in the research literature which show that it is possible to redesign work in the sector. Again, I won't go into detail, but one study looking at social workers in Israel showed that if you develop people's skills, that boosts their self-efficacy and their motivation, and burnout was reduced. Another study looking at Buurtzorg, which I'm sure many of you have heard about, but Buurtzorg this time in Scotland, not in the Netherlands. And this was where nurses and social care workers came together to work in a self-managing team with very clear goals. And again, improved staff engagement, so better well-being, and also better quality of care. And the third example, of a study very similar to what we are proposing to do here, which Anya and Helena will talk to you about more, a participatory work redesign, and that's what we're really proposing, of hospital staff that focused on giving people a bit more agency, giving them more support, reducing the demands. And this study showed that the intervention improved. There was a control group that got worse, actually, but the people that were involved in the intervention had better work design and reduced burnout. And I'm very much aware there are some great innovations happening in this sector across Australia. And what we're really hoping is to be involved in helping to evaluate some of those so that they can get publicised more broadly. So just to summarise, what I've suggested is that mental health and wellbeing is very much affected by work. So we need to look at the work to see if we can actually prevent harm. So going beyond just focusing on providing counselling and so on to actually saying, can we create better work? I've suggested that the SMART model is just a useful way that we can think of to address those psychosocial risks. There is evidence that you can make work smarter. I'm not saying it's always easy, but it's possible. And we really invite you to join us on this challenging journey. And we'll go back to Anu now, and then you'll hear more about how you can join us on that journey if you are interested. So thank you very much.
Thank you so much, Sharon. I'll just start sharing my screen again, and we have a few really awesome questions from you after that presentation. I'll just pick one that I think a few people are interested in. And someone asked, do we need to improve all aspects of SMART, or can we get improvement on, psychosocial risk if we address just a couple of aspects? And I think this would be really helpful for people who are considering getting involved with us.
Thanks, Anu. That's a great question. So the very first thing that we would always do, and Anya and Helena will talk about this, is we will start with an assessment of what are the key psychosocial risks, or what are the key aspects of SMART that are relevant in your organisation. So we absolutely do not need to address all of them. I mean, it may well be in your organisation that people have got plenty of stimulation and opportunity for growth, but where the struggle is around demands. So then we would focus on that. Having said that, as I mentioned, sometimes we can't really change the demands, and this is particularly true in this sector. It can be challenging to reduce the demands. We can try by making things more efficient and so on, but sometimes that's challenging. And then actually what we know from research is if you give people more agency, if you give people more support, if you make sure they're clear about what they're doing, they can actually tolerate those demands better. So sometimes the solution involves more than one aspect of work design. But absolutely, we need to be targeted as to what are the issues in your organisation, and the solutions, the strategies, also will be tailored to your organisation. There's not a one-size-fits-all here. So that's a great question, thank you. And people are asking about the slides, very happy to provide those after.
Yeah, thank you so much, Sharon. And I think we can just fit in just one more question, and we can address this a little bit in Anya and Helena's section. But people are asking how can we get involved? And I was just wondering, what is your top key ingredient for getting involved in smart work design research?
Yeah, so obviously you'll find out more how you can get involved in this particular project later. But, you can also do things yourself just using that framework, right? So, at a very sort of basic level, you could even just, have conversations with your team around, how are we on these SMART dimensions? Where could there be some improvements? For example, one very simple thing that we do sometimes in our own workplace is we might just do a SMART check-in. We might just pick one letter and do it each week. It's probably a bit much to do the whole thing, but we might just say, okay, I'm stimulating this week. How is everyone? And so, you know, you can use this model in whatever way you like, but it certainly can be used in a very, you know, just simple way, as I've just suggested. But thank you, Anu, and I think that's probably it from me. So lovely to have the opportunity to do this, and hope to meet up with some of you more as we go forward with the project.
Absolutely. Thank you so much for your time, Sharon. We'll have a few more opportunities for questions at the very end. So now it is my great pleasure to introduce two of our next key guest speakers. And I'd like to firstly welcome Khan Nelson, who is the Executive General Manager of Strategy Innovation at Widden Group. Khan is responsible for strategic planning, research and innovation at Widden. This includes innovating in the well-being space, improving quality of life for older people with care needs, and developing Widden's award-winning relationship-based care approach. I'd also like to welcome Jackie Hopwood, who is the Executive General Manager of People and Culture, and Jackie provides leadership and direction across the full remit of people and culture at Widden. This includes industrial relations, workforce planning, solutions, etc., and employee well-being. So today, without further ado, I'll hand over to Khan and Jackie to talk about their experiences in the industry and the value they see for the Design for Care research project.
Thank you, and thank you everyone. So my remit today is to really talk around our experiences and some of the challenges that we're seeing in our industry. So yes, we're in aged care, and I have experience in aged care for at least 6 to 7 years. And from our perspective, and the reason that this project particularly resonated, is that we're seeing a lot of pressure in the environment. And for those of you in the industry, I probably don't need to articulate exactly what that pressure is, but there's been a lot of sustained pressure in the aged care industry for quite some time. And during that time, we're also asking our people to do more. We're asking them to give more of themselves in the way that they care. So I think from our perspective, Widden is a very people-oriented organisation, but to meet the pressure and match that level of pressure that our staff are under, we need to do something a little bit different, and we need something that's much more sustainable than the approaches that we've taken in the past. So to give you some insights, we recently did a survey, and we had some results in that survey that were less than we would have desired, and that was around drivers of employee engagement and motivation at work. And that's why this really resonated with me when I heard about this project. So some of those indicators were around flexibility, well-being, empowerment, choice, and prioritising mental health. And we did score a bit lower than we would have liked and compared to other organisations. The feedback in that survey from our staff was that they felt that decisions around the way that they work were largely set by leaders as opposed to themselves, and that in order to thrive and have autonomy, they wanted to be more involved in the design of work and decision making. Other issues that we have seen, which probably resonate with some of you, is higher turnover, in particular in the last 12 months with COVID, higher absenteeism, and a lot of personal sort of challenges coming through for people in the industry, carer responsibilities outside of work, as well as having to care for people as part of their role. I also manage the workers' comp claims, and this resonates with some of the things from iCare around, we're seeing an increase in psychological injuries, and those claims in particular are much more challenging and costly to manage. What I have noticed and I can see in those discussions around those claims, there's less conversation around preventative measures than you would traditionally see around a claim that might have something to do with manual handling or a slip or a trip or a cut in the kitchen. We're having more proactive conversations around prevention around those more traditional types of claims than we do around psychological injuries. And the factors that go into those psychological injuries are much broader as well. In general, the way we approach things is very much in that sort of trying to prevent, probably less in the holistic way of having a look at those injuries. So we do have an EAP service. I can say from experience over the last 6 years, very low take up in the industry on employees using those EAP services. In some cases, we get less than 1%. That's quite a low take up, and through discussions with staff, there's various reasons for that, such as there's a distrust that that service is confidential, but more so it's normalising things. There's a tendency to normalise experiences. So, for example, a case may be around, say, resident aggression. They can often lead, those incidents can lead to psychological injuries, and when you have conversations with employees about reporting those incidents, there's a tendency to say, but that's normal, that's part of a job. We want to break that and see that that's not normal. We want to hear about those things so that we can manage them more proactively. I mentioned at the beginning that we're asking people to do more, we're asking them to care differently, we're asking them to make those personal connections, and Khan will speak a little bit more about that. But one of the things that comes through is a lot of carer fatigue. People are getting tired, and there's a real gap, I think, in the market around care for carers and what to do about carer fatigue. And there are some programs out there, I have researched it, they, to me, come across a little bit more ticker box exercise, put people through some training, it's face-to-face, less pragmatic and sustainable for us when you have, you know, very regional remote footprint. We've got 22 sites across New South Wales, 1 in Queensland. It's face-to-face training, a little bit harder for us to sustain the outcomes with that sort of program. For me, having a look at something much more progressive and innovative like what we're talking about here today around building in that design of work so that it's much more sustainable rather than a ticker box, you know, face-to-face training or something on e-learning. So from my perspective, I'm incredibly interested in the link between mental health, design of work, and if I can get outcomes for employees that they feel more engaged, empowered, and there's sustainable improvement in engagement and mental health through the design of work. It's part of the reason that we put our hands up to participate in this very exciting program. I'll pass over to Khan.
Thank you, Jackie. Yes, as Jackie mentioned, one of the key things that we've been looking at really over the last 3 to 4 years in terms of our care delivery approach is really trying to shift the culture of a task-focused approach to care to a person-centred approach, which is built on relationships and trust. And unfortunately, those of you who know the industry, over this task-focused approach to care where there's a lot of pressure on staff to shower 20 residents by 10 o'clock, and the community care staff they might only have a 15-minute slot or a half-hour slot in which to perform a lot of tasks for their clients. So you end up with this situation where everything is focused on getting the task done, and the people get lost in the process. So really what we've been looking at, as Jackie said, Widden is a very people-focused business. We're very focused on well-being for our clients and residents, as well as well-being for staff. So we've been trying to shift that focus and that culture away from task to the people, to a much more person-centred and what we call relationship-based approach. And actually, we've been working with the University of Sydney around designing a whole new care approach and retraining all of our staff. So it's not just about the care staff, but it's everyone who's involved in relationships with our residents and clients, and also generally around relationship building around teams and staff. So this has been a 3 to 4 year process across the whole organisation. And we are asking staff to bring much more of themselves to work. We're asking them to form deeper bonds with clients and residents. We're asking them to partner with families to make sure that the quality of care is much, much higher and much more tailored. We have a buddy system where every resident and client has a go-to member of staff that is their person who will advocate for them and who is really the person that they will probably form the deepest bond and have the greatest trust for. So as part of this, we're really valuing the soft skills that our staff have and their personal skills, which is a good thing. And what we've seen over those 3 or 4 years is great outcomes for residents and clients. However, what we are seeing is that there is an emotional toll. That asking staff to bring more of themselves to work and asking them to form these deeper bonds also means that they become more likely to experience higher levels of grief and loss, for example, when residents and clients die. And there is a carer fatigue element as well that can come into play, as Jackie mentioned. And we have been looking at ways of trying to support this. Again, as Jackie said, there doesn't seem to be a lot of useful or viable ways of doing this or building it in a sustainable way into the design of our care approach. And it really isn't practical to try and support our staff on a one-to-one level.
Sorry, Jackie, I'll just jump in there quickly. I thought that that was an excellent segue into the Design for Care research project. I just thought that in the interest of time, I was thinking that perhaps we could give you just a minute more, and then we can move to Paula and give the audience a chance to ask you a couple of questions.
Of course, I'm just about at the end anyway.
Amazing.
So yeah, so really we see this project comes at a great time. We're reviewing our relationship-based care approach at the moment with frontline staff, engaging them to find more sustainable ways to support the approach. We're really hoping that this project will help us in this respect, and I'm sure it will, and will really help us design into our care approach and into the way that work is structured at Widden, that how we make sure that we can support them, to mitigate some of these issues. And I think this is very relevant for Widden, and it's also incredibly relevant for the whole of the aged care industry.
Thank you so much, Jackie and Khan, for those valuable insights. And I think we'll have a little bit of time either after Paula or at the end for a couple of questions. And I think, yes, those were all really important points. And to talk more about that, I'd love to welcome our next guest speaker, Paula Holden, who is the Chief People Officer at Key Assets. And she's an established senior executive and board director, and brings a wealth of experience to the organization and employees that she works with. So over to you, Paula, to talk a little bit about your experiences, and I might just jump in at the end if we're kind of running a bit over.
Thank you. Thank you, Anu. And thank you, everybody, for having us along today. We are absolutely thrilled as Key Assets Australia to be joining the project and the research. I think it's a really, there's some really strong strategic alignment for us as an organisation. For those who don't know Key Assets, we're a non-government, not-for-profit, and we provide services across Australia to children, young people and families, with a particular focus on foster care and young people with disability. So we're sort of morphing into that disability space a little bit at the moment, and I guess that's some of this. I'll talk about that a little bit further today. But I think when you think about our purpose as Key Assets, we are about bringing to life and developing relationships and strengthening and growing people, particularly with a focus on children and the young people we serve. So for us, our services are an extension of our people. And I think for us, having a workforce that feels, and Sharon, to reflect on your language a little bit, I guess the contemporary language is well-being, but the language prior to that was really that psychological safety. And we know as business people, we know that psychological safety comes where people feel valued and able to be their best selves at work. And I guess part of our strategic intent is to be innovators and leaders in the way we provide care to our children and families. And in order to do that, there needs to be a level of engagement and a high level of, I guess, optimism within the workforce. So there's some really strong strategic intent and alignment in the project for us at Key Assets. And I guess if you think of that in the broader sense, we know we're heading into a market where talent is tight. We're talking about things like a war on talent, the Great Resignation. There we go, we've said it again. It's becoming the pivot or the agile of last year, the Great Resignation. So this could be for us a key differentiator. If we get it right and we're able to really coin that work design for the best outcomes for our workforce. Just reflecting on some of the challenges within our current staff experience, I think it needs to be said, but I won't spend too much time there. The current environment around COVID has obviously brought about much change, both in an environment, in a broader sense outside of the organisation, but then also within our organisation. We've had to remodel the way we provide our work services. Generally, our service provision is quite an individual, tailored, complex environment. So we have social workers, we have allied health workers. There's a really high demand for their services right now, and probably exacerbated by that shift in environment. So change, COVID. All of those shifting complexities, I guess, are having an impact on our workforce. And through that, I guess, we are seeing a level of turnover, which, whilst it's not exceptionally high at Key Assets, it is increasing as the general environment changes rapidly. I think what we're also seeing here is a real focus on, it's not a shift, but really there's a real level of focus on compliance. So things like worker screening, things like the administration that sits around our service delivery is becoming even more onerous. And I guess that takes time out of our workforce are here really to deliver outcomes for our people. And when it takes them away from that, it can become a detractor for people in their workspace. We also have some data which we've gathered through our annual engagement surveys around our staff, and some of the things that we're hearing from our people is that they really want us to there's an opportunity to focus a little bit more on the reward and recognition component, and that comes from their peers, and that we can really harness that peer relationship a little bit more in the way we do our business. And I think it could even be stemming, without jumping to solution, from some of that individual work they're doing on a day-to-day basis, needing to feel part of a broader team. Ultimately, what we are, the value we hope by participating in this project, both to the industry but also for ourselves and the research, we hope there'll be some practical takeaways, but also things that are able to be applied across different workforces. And I guess just to make that research real, we are all unique and we all do things a little bit differently. But I guess if we can work towards optimal health, as Sharon spoke to, if we can get our people in that green zone, there's a real opportunity there to keep people in our sector and keep people well in our sector.
Fabulous. Thank you so much for your insights, Paula. And it was really great to hear from two quite different, two organizations that work in the care sector, but in also very different aspects of it. And I think we have time for just one quick question. And I guess I'd love to this one's for, I'll just pass this on to Jackie quickly, but you mentioned, you were similar to what everyone has been saying, the mental health claims have been skyrocketing lately. And yeah, and I was just wondering, was that in your frontline workers? Was that in, what particular group was that in that you noticed that?
It's definitely the frontline workers. So the carers, registered nurses, but mostly the carers. So our assistant and nurses.
Yeah, that's really interesting, because I think when Sharon was talking about those outcomes earlier, and that's very similar to the findings that we're seeing, all over the country. So I think we have a little bit more time for everyone to ask you a couple of questions at the end, but just in the interest of time, I'll just forward on to our next speaker, and we look forward to hearing more from you just shortly. Thank you so much to all our guest speakers.
I know you're on mute.
You're on mute.
Oh, thank you so much. Did you guys hear when I said, Oh, okay. I just was thanking Jackie so much for her response, and and we will have more time for questions shortly. All right, so now I would just like to introduce our two next and final speakers for the day, Associate Professor Anya Johnson and Associate Professor Helena Nguyen, our leaders in the University of Sydney team for this project. Anya is the Deputy Head of Discipline in Work and Organisational Studies at the University of Sydney Business School. She is also the co-director of the Body, Heart and Mind Business Research Group and the 2020 recipient, along with Helena Nguyen and Sharon Parker, of the Australian Business Dean Council Award in Research, Innovation and Excellence in Research. Anya typically investigates how employees regulate their emotions and cognitions in the workplace, and the relationship between design of jobs and teams and outcomes such as engagement, well-being and performance. Helena Nguyen is an associate professor and also a co-director of the Body, Heart and Mind and Business Research Group. Her research expertise lies in the area of emotions at work and employees' mental health and well-being. And her research aims to improve the effectiveness of organizations in examining well-being and performance. She is the recipient of several prestigious awards from the Australian Research Council, NHMRC, and, as I mentioned, a co-winner of the Australian Business Dean Council Award for Innovation and Excellence in Research. Over to you, Anya and Helena, and I will advance your slides for you. Please tell me when you'd like me to just say the word next.
Great, thank you. Hopefully everyone can hear me. So far in this presentation, we've been hearing from Rashi, from Khan, Paula and Jackie about why this presentation, or why this research project is so important and their motivation for being involved in it. And we've also heard from Sharon, who is the world expert, sorry Sharon, in this area of research, talk about what work design is and the evidence we need about why we need to focus on work design if we want to improve mental health outcomes, and not just to prevent harm, but to promote that thriving at work. So Helena and I will now talk about how this project is unfolding and what's involved, or how you can get involved, and why also it's a research-based project. So I'll start by going back to the goals of the project. How can we leverage work design as an intervention to reduce or prevent psychological injury in this industry? In other words, we want to build the capacity of organisations to take better care of those who do the caring, and to do it using a really evidence-based approach. So we're approaching this challenge as applied researchers rather than as consultants. We don't have an off-the-shelf solution. We don't have a one-size-fits-all solution either. So I think you mentioned that, Jackie. Rather, we want to partner with organisations to really understand how we can apply evidence-based knowledge and strategies in this really critical industry. And we want to be able to evaluate how different approaches to work design work to see what works. Not only to see what works, but see for whom it works and in what contexts. Because all of those things are important. We need to understand context, and we need to understand how it influences different roles and different individuals. So as researchers, we're independent. And while this project is funded by iCare and they're passionate about us achieving outcomes for this industry, they've selected our team to carry out the research because we are independent and because our mission or our vision is to design work that promotes good mental health and the kinds of jobs and work environments where carers don't just survive, we want them to thrive and to care for others in the way that they can or they best can and the way that they want to. So we also come to the project with a particular philosophy about how to do engaged applied research. We have a really strong belief that as researchers, our goal is to build capacity within organisations we partner with. And really so that organisations can develop their capability to continuously improve work design and mental health outcomes. So our role is also to share and disseminate what we learn so that we can improve the sort of evidence base, the knowledge around this area, but also so we can learn and inform outcomes across the industry. We are applied researchers. We work in business schools and we do that and we bring our research with the intention of sharing that not only with the academic world, but also with society and organisations more broadly. Okay, so now let me hand over to Helena and she'll take you through what becoming a research partner means.
Thanks, Anya. Anya, can I have the next slide?
Correct one?
Yeah, thank you. So what I'll present now is what we call the PATH model to smart work design. The PATH process involves a number of stages, and I'm going to take this opportunity just to walk you through so it's a lot clearer about what this project actually entails. So the first stage is the preparation stage. This is where we prepare for collaboration with the organisation. And this involves things like establishing support from leaders from within the organisation. Having people like Paula and Khan and Jackie, these are our really critical key contacts. Setting up the logistics that works best for the organisation and identifying key champions for the project at all the levels that's required. And this really helps us to create the buy-in that's needed for the project to be successful. And then we moved, after the prepare, we moved to the assess stage. And this is where we do a bit of what we call a temperature check to gain a better understanding of the existing situation in terms of people's current work design, the psychosocial risks that Sharon presented in terms of the big SMART model, and also assessing things that are very critical to this project, such as wellbeing, engagement at work. In terms of the different types of data that we'll collect as part of the assessment stage, we'll look at different sources, and that's really important so that we are capturing a range of different perspectives and so that we can try and triangulate. So we'll collect data through things like the interviews and review policy documents, and we'll conduct the big SMART survey that will give us a lot of data about the SMART elements that Sharon discussed. And also this is actually really important to us as well, and where possible, we'll look to collect objective organisational outcomes such as HR records like sick leave or absenteeism, turnover, and where it's available client customer type outcomes. So by analysing how people's work design influences these bottom line or these harder outcomes, we'll be able to make a more compelling case for change. Next is the reflection stage, and this is where we bring all the temperature check data together to make sense of it all. And we'll be able to, along with, in partnership with the organisation, to identify, well, what are the key strengths, what are the risks, and what are the opportunities for change. We'll provide a lot of feedback at that stage, and based on the evidence that we've collected, we'll work on next steps so that we can start to transition to the new situation. So in this project, our intention is to create change. So it's really important that the organisation has a desire to improve the status quo, and that we're willing to make changes based on the evidence, to give things a go, to try things and to evaluate them. And so that's that redesign stage there, which is really at the heart of the whole PATH model. Then we move to the tracking stage, and again, another really important stage for us, because we need to know whether the effects of the change, what's happening, does it improve the outcomes that we're seeking to improve around mental well-being and mental health? Is it even sustainable? Are there unexpected, unintended consequences, for example? And the final stage of the PATH model is the habituation stage. And this is about, and this I think Paula mentioned this as well, is about embedding the change and scaling it, looking for opportunities to scale the intervention and ensuring that the work redesign change can be sustained. And this goes to Anya's point just now about working closely with the organisation to help develop the organisation's internal capacity to continue the work well beyond this project. So you can see, reflecting back, that the PATH model or the Path to Smart Work Design model, it's a highly collaborative process from the beginning to the end. And they say, you sort of get what you put in, and I think this will certainly be the case for this project. Anu, can I have the next slide if that's okay? So what we'll do now is, a lot of this is quite, high level in some ways. And so what Anya and I thought would be quite nice is to share with you 2 more concrete examples of work redesign that's based on our own research to date. So I'll discuss the first example, then hand over to Anya to discuss the second example. The first example is a larger redesign at the Prince of Wales Hospital. This occurred a few years ago, actually, when Sharon was still in Sydney. The hospital identified a few major issues with junior doctors, particularly junior doctors who were working on the overtime shift. The overtime shift is a really, really challenging work environment. Hospitals in themselves are challenging, but the overtime shift in particular. Junior doctors are often very tired, very fatigued, after they've been working maybe a shift before that. And there isn't a lot of support available during this, what's known as this screensaver mode hours, which is between 5 p.m. to 11 p.m. So what we did was we worked really closely with the Prince of Wales to evaluate the effects of the implementation of an advanced practice nurse, an APN, who is a senior nurse with qualified skills, a lot more higher qualified skills. The idea behind this redesign, and it's an example of a bigger change. Anya will give an example of that, something that's not as radical, is to build a support mechanism that cuts across a few of the smart elements that Sharon was discussing, actually, changing the level of demands so that it's more tolerable with the support of the APN, the amount of relational support in terms of the interaction between nurses and the junior doctors, and the opportunity to use and develop new skills for junior doctors. And basically what we did in brief is, in comparing overtime shifts with and without the APN, we found a number of really significant results, such as fewer medically urgent situations when the junior doctor was supported by the APN. And overall, this whole work redesign, it helped junior doctors who were feeling really quite overwhelmed and burnt out. So from a tolerable work demands perspective, that significantly improved. And for those junior doctors who were actually feeling quite confident, because there's variation in that, it just gave them more opportunities to learn and develop new skills. And as a result, the Prince of Wales actually implemented the APN position on a permanent basis. And that's been one of the highlights of our work redesign projects. I'll hand over to Anya now to share with you our second example with the SES LHD district.
Thank you, Helena. So in this example that I wanted to give you, we have been collaborating with Southeastern Sydney Local Health District over a number of years. And at the beginning of one of our projects, we did a district-wide survey across all 9 facilities across southeastern Sydney. And as we were presenting the feedback, so this is the temperature check, if you like, that Helena described earlier, we noticed a pattern emerging, and it was nurse educators. And they were reporting substantially higher role conflict and lower role clarity than all the other nursing roles. And alongside that, they also had higher burnout, they had lower job satisfaction and higher turnover rates. So just again, perhaps to describe that role, nurse educators are embedded in wards, they're supporting the nurse unit managers, and they're supporting the learning and development of the registered nurses on the ward. So each nurse educator was in a different context, but they were experiencing similar challenges across the district with the design of their role. So part of the kind of reflection phase that we went through with South East Sydney Local Health District was to organise some facilitated sessions with the nurse educators. And we were able to share results, or the results of the survey, and show how their role contrasted against other roles. So against the nurse unit managers, against enrolled nurses, registered nurses, clinical nurse consultants, and so on. And then we were able to have that kind of conversation about what were the challenges of their roles. What does low role clarity look like for them? So let's make that even more concrete and kind of tease that out a bit more. And based on that, what the district was able to do was to kind of gather together all of the ways in which the role could be clearer and could be more sustainable, and created clearer role descriptions. But that in itself is not the answer. So what was more important than that was that having developed that clarity around what the role could be and would ideally be, the next step was really around creating local forums, and that's where the nurse educators could work within each of their leadership teams in their hospitals and in the wards to create really a shared understanding and an action plan. So ways to manage conflicts, ways to improve their role within the context that they were working in, not just generically across the district. And those changes really emerged from conversations that they were able to engage with. So they weren't imposed by the district or by us. Our role was really just to create the space that they needed to have those conversations. So it's about creating the space, but it's also about creating, I guess the burning platform, if you like. We can see that there's an issue. Now we need to work towards how we actually resolve that. And what was really exciting was that when we did the district survey again, the nurse educators reported much higher role clarity and much lower role conflict, and had better wellbeing outcomes, which was fantastic, because the district really had invested and the hospitals had invested in trying to make those roles clearer and more sustainable. And I think it was rewarding both for them and for us to see that investment actually had some dividends. All right, so those are 2 brief little examples. One of them, as Helena mentioned, was quite transformative. The other was a bit more emergent in the sense that it kind of came from the lived experience of the nurse educators. So I'll go on to the next slide. Thanks, Anu. So you've heard from Widden and Key Assets, who we're already partnering with on this project, and we're having conversations with a few other organisations in the sector. But if you think that your organisation would benefit from being part of this kind of research collaboration, we'd love to hear from you. We're also looking for we're looking for organisations in this industry who are insured by iCare and who, as Helena mentioned, are enthusiastic. That's pretty important, and open to working in partnership with us. Those are 2 kind of critical elements. We're also planning to create a community of practice to support and enrich this project and to help with disseminating the findings, and also to ensure that we have or create create learning or produce something that is fit for purpose for this industry. We don't want it to be super generic. We really do want to be able to create resources that resonate, that make sense, that people say, yeah, I get that, because it speaks to them. So for this community of practice, we're really looking for a range of stakeholders who have an interest in this industry and who have an interest in improving outcomes in this industry. So they could be from government or from other kinds of funding bodies. They could be peak advisory bodies, they could be industry groups, or people with lived experience in this industry. And I'll go to the last slide, Anu. So in terms of the actual community of practice, we're looking for about 12 to 15 people. And what we're asking is that you'll come along to about 5 meetings over the next 18 months. The meetings will be about 2 hours long. We don't expect you to extensively prepare for each meeting, but rather consider what we're proposing and give us some feedback, give us your insights. And we're also hoping that being involved will be interesting and helpful for you. It'll provide you opportunities to learn more about the research and the outcomes that we're seeing, and also to connect and share your experiences with other people in the industry. So I'm hoping that it won't just be of benefit to us. I'm really hoping this community of practice will also be a rewarding experience for you. And I'll finish up there.
Oh, sorry, I stopped sharing my screen accidentally. Yeah, I just wanted to say thank you so much to Anya and Helena for giving us that insightful, that insight into the research process and also the community of practice. And I think we do have a few minutes for questions. So I'll just start with one for Anya and Helena. Anya, you mentioned that one of the things that we do as researchers, especially in the work in mental health space, is create, a space needed to have transformative work practices to better well-being. And somebody has asked us, how do we continue to tackle the stigma of mental health? Because it remains a barrier to people feeling confident to speak up. So how do you feel that smart work design can be part of that solution in the work that we do?
Hi, Anya.
Either one of you. It's a question that came up during your chat.
Yeah, I can start, and then Anya can feel free. Anya, jump in. It's just such a good question, and I think that the issue around mental health, at least from the clinical perspective of mental health, is highly stigmatized. And I think it's an issue and the more awareness that we can have and these types of conversations, I think, are really critical in changing the conversation, in making people feel more safer to discuss these things. But I think particularly from a work design perspective, mental health is, as Sharon discussed, is not the one end of the spectrum around mental ill health. It covers this full spectrum all the way to thriving and flourishing and being able to really be your best at work. And I think that's part of the bigger, the broader conversation that we're having, which shouldn't be stigmatized at all. So I think that's one of the key values actually of work design. It doesn't just speak to the one end of the spectrum, it really covers across the whole. Anya, did you have some additional thoughts on that? But that was my first thing.
I think what else, the other parts that can be quite helpful is that it also helps to talk about mental health as a spectrum. So, I think Sharon did a really nice job of kind of characterizing how we can view mental health from one end to the other, and that when we talk about mental health, that we're not just talking about the ambulance at the bottom of the cliff. We are actually talking about how we build good mental health across the whole organization, and that we all should be feeling good at work. We all should be thriving, feeling that we're contributing, feeling valued. And I think being able to have conversations about that then also opens up the room or opens up the space to then talk about, well, when aren't we feeling that way and what does that look like for us? And not to have people feel that they can only raise mental health if they're at that clinical end, that we need to be talking before people get there about these issues. And I think doing things like a temperature check where you're actually asking people about how they're feeling and then talking through those results and those outcomes really helps that conversation, because it's hard to talk about something you're not measuring and you're not sort of sharing with everyone, that this is evidence from us. This is how we feel. It's not just a sort of a conversation that isn't based around evidence. And so I do think those things are helpful.
Thank you so much, Anya and Helena, for that insight. What I'll do is I'll just stop sharing my screen. We have a little bit of Q&A time, just a couple of minutes for all of our guest speakers, and perhaps so that we can see everyone, we'll just check it out. All right, so I would really like to direct the first question to potentially either Jackie, Khan, or Paula. Perhaps Paula, will start with you. You know, someone asked us, we're interested to know how young, insecure workers are being impacted as a subset of focus area. And I was just wondering if you had any insights from your organization as to how your younger workers are being affected by potentially the Great Resignation or the work design issues.
I know I'm probably the wrong person to ask right now on that, in that data is actually one of our starting points. So to Anya's point before, what we measure, we can, I guess, get some insights against. We're at the start of that journey, so we are really trying to get those insights together. But at the moment, anecdotally, having conversations with managers and even as late as yesterday, I think what we are seeing of people who are newly graduated out of university, particularly in our allied health space, is that they are highly mobile, and there is a particularly chasing role titles or career progression. And if people are coming to the table with an offer, what we're often seeing is counter offers. So in that employment space, it's a highly liquid, I guess, workforce at the moment as far as who can counter offer and how we can see that. So I probably don't have the data to back that up right now, but that's the anecdotal, what we are seeing.
I think that's a really great point, though, and that kind of speaks to why we're kind of doing our research, to assess where all of the pressure points are. And I guess if either Jackie or Khan, we can have about a minute to just kind of hear your thoughts on that. Do you have any data on that or hypotheses?
On the vulnerable, the younger workforce. Mm-hmm. So in terms of psychological injuries, for example, or if we're talking about that, it is in the older demographic. We are seeing that, but by the same token, we don't necessarily have a young demographic. So the data in terms of our average age is probably around the 42 to 45. The younger registered nurses, I would say that we are experiencing high churn, very high churn in that younger demographic, and the feedback being lack of support or the complex nature of the role, the decision making, the requirement for decision making and clinical decision making. So we need to look at ways of supporting those graduate nurses more, and this is an industry-wide challenge to first of all attract them to a sector that they may not consider to be the one that they dreamed about when they were young and wanted to be a registered nurse. So we need to break that stigma there, but once they are here, how can we support them in terms of making sure they're successful? And I do see a high churn around for that younger demographic of registered nurses, and it is around they didn't realise how much they'd need to give to the role. I'm not sure where that question was sort of going, but yeah.
Sorry, I was just going to jump in and say we also need to look at the mature workers too, because that is a big demographic in this sector. And also, you know, it's the population is aging, so we're going to have more mature workers into the future. So But I guess that speaks to Alex's research that he's going to do too around the, you know, where are the pockets where there is vulnerability.
Yeah, thank you so much, Sharon. And actually, that's a really good segue into just looking at what people have said in your Slido poll about where they actually see the most critical work design challenges. So I've just got on my screen here, as you can see, you know, a lot of people have talked about workload, support, job variety, and even autonomy. And we can see here just exactly what our speakers have talked to today. There's a lot of emotional drain and feeling undervalued that perhaps, you know, we can kind of try to address in our research. So now I apologize. I need to stop sharing and reshare because I am slightly, there we go. I would just like to, just in the interest of time, probably just provide a quick wrap up. And firstly, I would just like to thank all of our guest speakers, especially to our research partners, Khan, Jackie, and Paula. And we're so excited to work with you on this amazing project. And if you would like to, you know, for the people here today, if you'd like to get involved with us, either being a Design for Care community of practice member or in the PATH process, just register your interest. Say, hey, when you guys get down to, you know, really talking more to organizations, because we're already doing that, but we'll be doing that over the next few months, please head to our new website, which is launching today, using the link in the chat or on our slide here. There are a few, there's a registry, there's an expression of interest form, sorry, on our website that you can fill in. And I think all I just wanted to do is also ask if people who have kindly joined us today could give us a little bit of feedback on this event. Tell us, you know, what did you learn today about work design? What did you learn about the challenges in the industry? And one thing that we will be doing is we'll be sending the slides to all of our registrants, and the recording will be up on our website. And I know we didn't get to answering all of the questions that everyone put on Slido, but over the next, you know, when we do a bit of a summary, we'll try and kind of address a few of those questions. But in the meantime, if you have any questions, head to our website. There's contact details there for us, and we will get back to you. And we really look forward to hearing from everyone who has joined us today. So thank you so much. And Sharon, did you want to say anything as a quick?
No, I just wanted to ask our speakers to show their faces, and we can all give a wave goodbye. But just again, thank you so much for participating, our speakers, but also people out there. We didn't get to see your faces, but we very much appreciate your engagement today. So thanks everybody, and we hope to meet up with you soon.
Thank you so much, everyone. It was a pleasure meeting you all, and please do head to our feedback form and tell us what you liked about this event. Have a wonderful day. Thank you.
Thank you. Bye.